Hi, I'm Dr. Baxter. Thank you so much for choosing our office. It is a joy and a privilege to serve you and your family. Today we're going to talk about tongue tie treatment for infants. So here's my family, my wife Tara, and then our twin girls Hannah and Noelle. That's how I got into this whole thing in the first place. And then Molly is our youngest. And all three of them had tongue ties at birth, and so this is definitely a personal story for us. So we'll start just a little bit briefly with that. So our girls were born in June of 2014. As I was finishing up pediatric dental residency, and they were really struggling with nursing and taking bottles, anything. So we actually had to syringe feed them, and we were, finger feeding them and all kinds of things. And they realized that their tongues were tied down. So we asked our pediatrician. She clipped it for us. It didn't make much of a difference. And then our lactation consultant was telling me about, this is actually really common. And if you see a dentist with a laser who can fix it for you, it can help a lot. So we had that done and it helped a lot. And then that's kind of how my journey started, because all throughout dental school, we had one slide of one lecture in dental school on tongue ties. And then we had one article in residency out of the 2 years in residency with a master's degree. Nothing on tongue ties hardly. So it's not taught in medical or dental schools or speech and lactation programs even. So it's really a systemic lack of education. And so today you guys will, after watching this, might know more than a lot of healthcare providers, unfortunately. So let's get started. Oh, and then there's Molly. Sorry. Molly, she was born, of course, with the tongue tied. You can see it there visibly. And we got it done on the second day of life versus the girls didn't have their proper release till they're about 4 weeks old. So the younger, the better. So a few basics. A tongue tie is something that's too thick or tight or short webbing of tissue. It's from fetal development under the tongue that restricts normal tongue movement, and it causes a functional issue. So it has to be causing a problem. The symptoms the child has are more important than the appearance. So we really have to do a full assessment of related issues to diagnose a tongue tie properly. Otherwise, you might miss it. Having a patient stick the tongue out is the worst test to determine the presence of a tongue tie, but lifting the tongue up or elevating is the best test. And because that's the critical movement for key activities of nursing, swallowing, speaking, and proper tongue placement during sleep. So again, if it's not assessed properly, it can go undiagnosed for weeks, months, years, or even decades. So it's really a spectrum of lip restriction. These are all babies. Up in the upper left, minimal. There's no lip tie there. Even the second one from the left is not bad. But the other ones are blanching. They're turning white. They're causing distress to the child when you lift up on it. And often they have seal issues, like they're spitting up a lot, colicky, gassy. They're leaking milk out, that kind of things. The bottom right, that's the tightest I've ever seen. But it comes in all different shapes and sizes. The tongue, likewise, comes in a bunch of different shapes and sizes, from the tightest we've seen on the upper left to the most minimal that was still causing problems and still saw improvement after resolution, even on those ones on the bottom that most people would say, oh, there's nothing there, it's all in your head, but those ones can also cause problems. Here's a posterior or less obvious tongue tie. It just means less than halfway, basically, to the tip. And notice this is the same patient, but with different amounts of pressure or tension lifting up on it, you can see it pop up or not. Here's the same thing in a child. Can go undiagnosed in children too. So, if a baby has a tongue tie, it's possible that other siblings or even one of the parents could have a tongue tie as well. It's often, but not always, genetic. But there's a lot of myths and misinformation about tongue and lip ties, like they don't exist, especially posterior tongue tie, or they don't cause problems. It's very rare. In fact, it's probably about 1 in 4 babies or 1 in 4 children have a tongue tie. A study out of Brazil recently said 32% there had some kind of restriction. Often people say, oh, it'll stretch out, or the child will fall and rip the lip tie, but that doesn't help you with a baby. They're not walking yet, of course. So a quick snip or with scissors will fix the problem. Really, you have to go deeper. When they snip it, they just cut it halfway often. That's what happened to our babies, the twins. Or they'll say, oh, they'll need general anesthesia or sedation to treat. And that's really not necessary. We do it up to any age, even teenagers with autism, without general anesthesia or sedation. And unfortunately, many babies have nursing difficulties they're just not resolving. Mothers are told it's all their fault, or what's the big deal, just give them some formula. But honestly, switching to a bottle, as many of you guys are bottle feeding and still struggling, it does not solve the problem. Babies still have the same issues. Or they're told, oh, just wait 6 months, it'll get better, or we can do general anesthesia. And then there's, of course, unknown effects of general anesthesia on the developing brain. So the younger they're put to sleep, the more effects they can have. So what can a tongue tie cause later on? Well, certainly speech. That's the big one people worry about, is speech delay, trouble with sounds, R's, L's, S's, K's, G's. They can be shy or embarrassed or frustrated with speech. trouble eating solids, like those slow or picky eaters that might be choking or gagging on solid food or water, small appetite, airway issues like mouth breathing, snoring, their tonsils could get big, development of the sinuses could have issues, poor sleep quality, which is huge because teeth grinding, restless sleeping, sleep apnea, poor behavior, ADHD, those things are common, but they're not normal. Right? Even babies, grandparents to babies, no one should snore. That's a red flag, something's wrong. And that can affect brain development. The brain's developing a ton while they're sleeping. Poor dental development too, so high arch palate, tongue thrusting, crowded teeth, higher risk for braces. GI symptoms like reflux and constipation, we often see that improve significantly after a tongue tie release. And keep in mind, the symptoms can change over time. So they could go away for an older baby and then start coming back when they're not babbling as much as they should or they're having trouble with solids. So we treat many adults with ties and they can last a lifetime. So teens and adults have to be working with a myofunctional therapist. So ask us for a list if you're interested for your older child or yourself. But right now you might be thinking, oh my gosh, like this is Johnny, like this is my 4-year-old that has this. So we can go over that, of course. So why do we use a CO2 laser? Well, there's minimal to no bleeding. It's typically less painful than scissors or a scalpel. Much better visualization during surgery. We can see what we're doing because of minimal to no bleeding. It's extremely precise. It's not like a lightsaber. It just cuts about the width of a human hair at a time. So it's very precise. Virtually no risk of infection. We've never seen one. We don't have to put them to sleep. It's very effective. It works well. It also has really good healing and scarring compared to scissors or heat-based methods like a diode laser. So not all lasers are the same. This is the highest quality CO2 laser available, and it vaporizes the tissue instead of burning it like a cautery or a diode laser would. So anyway, it works better. It still has a little bit of a smell to it, but it's not nearly as bad as those other methods. And we did achieve a board certification in laser surgery as well as pediatric dentistry, and we do more procedures than anyone in the Southeast. So a few risks and benefits. Risks from the most common to least common. I mean, of course, it's going to be sore, so discomfort. You could have some minor bleeding, trouble feeding for a couple of days, reattachment, so that's where it can stick back together. We'll talk about that. It's always possible to get an oral aversion. We may have seen this once or twice, but it's very, very uncommon. Injury to salivary duct or nerve, we've never seen that, although we have seen some clipped at other places where they did cut into the duct. We've never seen an infection, but it's always a possibility. Possible benefits, so better feeding on the bottle or the breast, less pain for mom, happier baby, less colic, reflux, gas. Basically, all the symptoms on the infant assessment sheet we have seen resolve. That's how we got the sheet. People come back a week later and say, hey, my baby's not doing this anymore, and this is much better. But it's really different for every baby. And so later on, you can also have improvements in speech, solid feeding, dental development, breathing, sleeping, and GI improvements in the present as well as in the future. So it can be protective against having speech issues later, although if I guarantee that, then it won't work, right? Because we never guarantee it, right? I don't want to jinx it or something, but we always hope and pray for the best resolution for each family. So during the procedure, we follow all laser safety protocols and use protective eyewear for everyone in the room, of course, including the baby. We swaddle the infant so they can't move, so it keeps them very still and keeps them safe. So parents often wait in the consult room during the procedure so we can focus 100% on the baby, and then we'll bring the baby right back to nurse or feed. The procedure is about 15 seconds for the lip if they need that, 10 seconds for the tongue or for cheek ties if they have those. About 1 in 10 babies we do have cheek ties. And then it's also a couple minutes to set it up and position the baby, take the pictures before and after. So we're normally back in the room at about 5 minutes for babies, sometimes less. Aftercare, so what to do afterward. We really want the baby to nurse or feed right away. Oral wound healing is rapid. The scab will turn a white or yellow color, so it can look like an infection or pus, but it's not. They might drool more, the upper lip might swell up a little bit. They could have some difficulty feeding for a couple of days, but typically with Tylenol, and then if they're older, like over 12 pounds or 6 months older, you can do some Motrin for pain. But always use the dosage on our sheet that we'll give you because often it's different than what's on the bottle. And so we'll give you a more accurate dosage for your child. You can do breast milk ice chips, so frozen breast milk, break it apart. Arnica tablets, essential oils, skin to skin, sing to baby are all adjuncts that can be used as well. But we often get this question too. Nursing or bottle feeding, nipple shield, pacifiers, those are all okay afterward. There's no restrictions. So basically do whatever you can to keep the baby comfortable and eating well so they don't get hangry. And then of course work with a lactation consultant or a feeding specialist the same week if you're able to. Normally the baby's sore for about 1 to 3 days, and it should improve little bits every day. So stretches. So this is to prevent reattachment, which was one of the risks. It can grow back together, right? If you got your ear pierced but didn't wear the earring, it can close up. So you're going to start the day after the procedure. Don't do any the same day, but we recommend 3 times a day for about 3 to 4 weeks, quality over quantity. So don't do any less than 3, but we want high quality stretches. Actual stretching time, about 5 to 10 seconds per area. Keep it playful if you can, make funny noises. Also, at other times, play with the baby's mouth and tongue when you're not doing the stretches. That can help to prevent an oral aversion. If you have a camping headlight or someone can hold a flashlight, that's helpful, or you can get one on Amazon. So first, you're going to lift the upper lip up so the entire diamond is opened up. Then firm but gentle pressure on the wound, massaging with upward strokes back and forth, kind of like a rolling pin. And then for the tongue, you want to come from behind, cradle the baby's head with your hands, use your left thumb to stabilize the jaw, hold onto their gum pad, and then the dominant index finger straight down the floor of the mouth, then up and back, basically pushing on the diamond. Put that tension to kind of stretch it out. So trying to stretch out the diamond like this instead of having it stick back together. So always start in the floor of the mouth, then go kind of backward on it. We don't typically go side to side. It's more up and down. For buckle or cheek ties, again, they're uncommon, but they do happen. Pull the cheek out like a fish hook and then kind of massage that area to elongate the wound. Again, reattachment is just a natural healing process. It's not that parents or the baby did anything wrong, but everyone heals a little bit differently. So we're trying to trick the wound to stay open. And it can happen very easily if you do no stretches or not enough pressure, and most people don't push hard enough, then it can happen fairly easily. So gentle but firm pressure, about 3 times a day. Check it, make sure it looks good. If it does look or feel tight, you can do a deeper stretch, just push a little bit harder. You might see a little bit of bleeding, a little bit of red stuff. We can do a deeper stretch at the follow-up visit, or you can watch the video on our YouTube channel if you live far away, but ideally we get most people back if we can. Also, if symptoms start to come back after they disappeared, so something got better, like it was less painful for mom, and then it came back, that's likely the reason is because the tongue was sticking back together. So do a deeper stretch or please come back to see us. You can still reopen it even like 3 or 4 months after the procedure, but much past that, we have to use the laser again. And this is a team approach, so we only do one part, but for the best symptom improvement, there are other professionals that must be involved. So a lactation consultant is critical for the baby who's been having difficulty breastfeeding. Most people have already seen the lactation consultant before they come see us, so make sure you follow up ASAP and continue to get as much help as you need until nursing is efficient and comfortable. But if you're bottle feeding, a speech therapist or occupational therapist can help, or with solid feeding issues. Body workers like a chiropractor, physical therapist, or craniosacral therapist can help if there's any tightness. So torticollis is a tight neck muscle, or other issues like if they're really fussy or like constipated, colicky, there's just a lot of tension. It can be very helpful to see a chiropractor or PT. And then, of course, the pediatrician for routine visits, well checks, referrals. And if you need any referrals to any of those people, we'd be happy to help you find someone in your area if we can. We always call later that evening to check on you and your baby. I have my cell phone number on the post-op sheet in case you have any questions. Otherwise, just let us know while you're in the office, or you can call us anytime. And remember, it's a process. So it might be like a better feeding in the office, but then could get more difficult for a couple days and then get better over the next weeks. Typically, it's 1 better feed the first day, 2 better feeds the next day, 3 better feeds the next day, kind of like that. There are a couple of groups I want you to be aware of. So there's the Alabama Tongue Lip Tie Support Group. There's also some state-specific groups for Georgia, Florida, Tennessee. We have patients come from all over. Tongue tie kids also, and then tongue tie adults. If you think you might have a tongue tie, you can check out those groups. Here's our book, Tongue Tied. We wrote it back in 2018. It's sold a bunch of copies and it's been translated into several different languages to help, because it's a worldwide problem. It's not just in Alabama. It's available on Amazon or Audible, but if you would like a copy, just let us know. We'd be happy to get you a copy for free to read and then pass on to your healthcare provider. So just let us know before you leave. And as always, we're trying to push this field forward. We've published several peer-reviewed research articles to help other dentists and medical providers, pediatricians, realize this is a real problem, and to help them see that. And through all our courses, the money from the book, all the royalties from the book, from our live course, some of you might hear on a live day, we have doctors visiting, or the online course we've had over hundreds of students take. All that money goes to support water wells and health clinics and human trafficking both locally and globally. So try to give back to the community here and there. And last but not least, most parents ask, what can I do to help spread the word? So Tell your healthcare provider what symptoms improved after the release. That can be very helpful so they realize, like, oh my gosh, this other baby could be having a tongue tie issue. And help friends who are struggling because, again, their healthcare provider may not have picked it up. Just because something is common does not mean it's normal. Consider making a social media post maybe a few weeks after the release, see what changes there were, and then encourage others to get their babies checked properly. And of course, if you'd like a copy of the book, we'd be happy to get you one to pass on to your healthcare provider. So thank you so much for listening. I know it's a lot of material. This is also on our website if you need to watch it, or on YouTube channel. But yeah, we look forward to serving your family, and let us know if we can help with anything.